From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Sydney Madison. Thank you for joining us tonight. A look at the top stories from our health team, including efforts to help vaccinate people migrating to the U.S. and how a cooking class is helping people with diabetes.
Tonight we begin with an in-depth look at an issue that's been gaining attention both nationally and here in Arizona, maternal mortality. The death of a woman during pregnancy, at delivery, or soon after.
A new state advisory committee is studying these deaths and working to identify ways to prevent them. On the Navajo Nation, one program is giving Native women the tools to help.
Cronkite News reporter Jennifer Alvarez traveled to Window Rock to learn more about this unique effort.
According to the CDC, women in the U.S. are more likely to die from pregnancy-related causes than anywhere else in the developed world. Native American women face some of the highest rates of maternal death, and right here in Arizona, those disparities are even more profound. So I traveled to the heart of the Navajo Nation and spoke with women there, hoping to combat these numbers by rekindling Native knowledge and teaching traditional practices to promote health.
It's building a revolution for us. And I think we're taking back and reclaiming our knowledge.
Okay, sweep your teepee, sweep your teepee.
Sweeping hands and happy smiles.
Make fire!
Fill the land on the Navajo Nation. These Native women are finishing up a day of training with a traditional game. They've been learning how to be doulas, or people trained to support women through pregnancy and birth.
Basically, they're helpers. And I always compare it to like how we help each other in ceremonies, like that's how we should help each other during birth and pregnancy and parenting.
Melissa Brown knows just how important these helpers can be.
My first birth that I had when I was a teenage mother was very traumatic. I didn't understand how my body worked. I didn't understand how labor and delivery worked. I was very scared. I didn't have very much support. And so when I got pregnant with my second daughter, when I had an Indigenous midwife, it made all the difference. I had an unmedicated, beautiful birth. It completely changed my life.
It's the first time this kind of training has happened here, and it's important that it does.
We're a desert for everything: food, reproductive health care, maternity care.
Local experts agree access to prenatal care here is limited.
The hospital isn't just around the corner, just around the block. A lot of our care takes probably an hour or so just to get to healthcare facilities.
The maternal mortality rate has increased substantially in the U.S. over the past years, and Native women are among those hit the hardest.
Something needs to change, not only here, but in other Indigenous communities. What happens in a lot of communities is we're bringing in non-Indigenous people who don't have that lived experience and delivering health education in a way that doesn't make sense to a lot of people in a community.
So Brown teamed up with Nicole Gonzalez, founder of the Changing Woman Initiative, to teach women how to use traditional practices to improve maternal health.
We are our own experts in our community. We can help ourselves. We can empower ourselves. We can educate ourselves. That's something that we really advocate for, is that education, that culturally relevant education, acknowledging all of those things that affect our health in our communities that are very different from someone who lived in the city that had access to a variety of services.
The Changing Women Initiative held its Indigenous doula training inside this hogan, which the women say was representative of a mother's womb. We weren't able to film inside during the workshop because they wanted to maintain a safe space for Indigenous women.
This is like the work of our ancestors and our grandmothers and our aunties. This is all a result of all of those Indigenous women and people that have carried this work over generations for, us and then the next generations.
Together, they hope to help Native women cope with trauma and loss.
We might hear from our elders that we're not supposed to talk about death, or that we have some taboos about being around places where people have died. In our Dene culture, that's one of our teachings. And so to have a really frank conversation about death and miscarriage and abortion and pregnancy was really like the heart of the issue I think a lot of people wanted to know about.
It's so much more than just the doula training and learning about birth. It's learning about ourselves, connecting with our own healing, and there's a lot of healing that happens in this training.
A lot of that healing especially happened during these moments.
Seeing everybody laugh and enjoy themselves and like be in their traditional dress. I wish the world would see Native women like that we're not sick, we're not dying, we're not vulnerable, you know, we're not our disease, we're not our social structure that's making us feel like we have to feel ashamed for having a baby at 20 or 15, but that we're out there playing and having a good time and like laughing, and like for me that's our true self.
Brown has brought her training to Native women across the country and in Canada. There were 40 participants at the workshop in Window Rock, and the women I talked to said they were ready to take back what they've learned and share it with women in their own communities. Live in the studio, Jennifer Alvarez, Cronkite News.
For months now, doctors, medical groups, and some members of Congress have been asking U.S. officials to provide vaccinations to help protect migrants against the flu.
The issue escalated after news that several migrant children died while in federal custody. At least one had suffered complications from the flu.
On the Mexican side of the border, medical officials are trying to help. I visited a shelter in San Luis across the border from Yuma. There, families are receiving free vaccinations while waiting to seek asylum in the U.S. Little Andrea Ramirez waits, watching her older brother get his flu shot. Vaccines aren't something that she and her siblings see every day. 2 shots and a few tears later, it's all over. The seat ready for the next person.
It is very kind of them because it is helping us.
Lopez, like other migrants, found shelter at La Casa del Migrante in San Luis, Rio Colorado, Sonora, Mexico. Here, they wait their turn. Their goal is to get political asylum in the United States.
We came to this house and thank God because they supported us, all migrants.
The director of this shelter says he makes sure they have what they need, including clothes, a bed, food, and a roof.
We have this room for 10 people.
But getting political asylum is a difficult task. According to U.S. Customs and Border Protection in the fiscal year 2019, close to 290,000 migrants were found inadmissible, and close to 860,000 were apprehended. So far this fiscal year, close to 72,000 were found inadmissible, and close to 104,000 were apprehended.
I am afraid that the United States won't welcome me with my mom and will send me back. We are afraid to return to El Salvador.
Another problem that they may encounter when they cross the border is the lack of vaccines. According to a letter sent to Congress from Congresswoman Rosa de Lauro, Customs and Border Protection does not want to provide vaccines to migrants.
Alarmingly, we have recently learned that CBP's decision not to vaccinate against this preventable disease ignores specific recommendations that the CDC made in January 2019.
We avoid illness. My little girl needs her vaccination because she hasn't received it since she was born.
According to the center, over 60 people received vaccines here today. Vaccines like this one, not just for the flu, but for the measles, mumps, and many other viruses. Organizations like the Mexican Red Cross and 100 Angels provide help, something that the migrants are very thankful for.
We hope we are making a good effort to prevent these diseases.
In the meantime, thousands of migrants continue to arrive at the border, looking for a better life, leaving their entire lives behind.
We don't have enough money to give our children well-being and a better life.
Even though the uncertainty of their future is always on their minds, they hold on to hope that a better life is out there.
Well, my future is to arrive in the United States with my mom because I want to give my mom and my little girls a better life.
There's a push here in Arizona and nationally to encourage more minorities to pursue medical careers to help address health disparities.
The number of Native Americans in medical schools and serving as doctors is especially low. Cronkite News reporter Tyon Marshburn traveled to Oklahoma to examine one initiative that's had success.
As two-lane highways transition to gravel and dirt, Piper Long's farm in Skiatook, Oklahoma looms in the distance.
We're in the middle of pecan harvest here in Oklahoma, and this tractor here is set up to shake the trees to help the pecans fall down to the ground so that we can pick them with our other tractors that have pickers hooked on.
Long isn't just a farmer, she's a mother of 3 and a medical student at the unusual age of 40. As an enrolled member of the Osage tribe, Long is one of the small number of Native Americans pursuing a career in medicine.
Growing up, I didn't have anyone in my family or anyone that I knew in my community who was in healthcare.
Oklahoma, home of the country's largest Native American population, is embarking on a partnership to address that disparity. Coming soon, a medical school on Indian land, the first in the United States.
Having a medical school on tribal property is unique, and I feel like it's going to improve healthcare in these rural communities and for our Native population.
Native Americans make up 2% of the U.S. population, but a mere 0.7% are enrolled in medical school. In terms of those who go on to be doctors, Alaska Natives and American Indians represented less than 1% of physicians in 2016. That's about 4,000 doctors of more than 700,000 people.
It's exceptionally important from a health disparities point of view, all right, to encourage individuals from rural and underserved communities to seek careers in medicine and to go back into those communities and serve.
Fugate mentors students like Long at Oklahoma State University's medical school in Tulsa. The facility is a leader in recruiting and training Native American students.
Here at OSU's Center for Health Sciences, students work on mannequins like these that are able to bleed and breathe. The mannequins are controlled by the students' instructors, and it allows them to get a hands-on experience before going out into the real world.
Student Brandon Posthook is a member of the Chickasaw tribe.
I grew up with a lot of, I guess you would call ACEs, adverse childhood experiences. We have substance abuse in my family, we have overdoses, we have pretty severe mental illnesses. And so those are things that are kind of dear to me and are close to me. And so those are one of the things that I really would like to address.
Once he graduates, he hopes to treat other Native Americans, something he never saw as a child.
As a kid, we would go to the hospital and never seen one native-looking doctor. And so it was kind of like, for me, it made me think that natives didn't become doctors because I didn't see any.
An hour's drive from the medical school campus, a new facility would bring this kind of training directly to Indian country. This day, leaders of Cherokee Nation have gathered for a grand opening of the largest tribal outpatient health facility in the U.S. But just down the road, an even bigger accomplishment. Construction is underway on the new branch of OSU's College of Osteopathic Medicine.
It is a great opportunity to increase that pipeline of physicians right here. I mean, we know statistically that a med student will practice within about 100 miles of where she goes to medical school. And so what that means is we put those statistics in our favor by creating a medical school in this unique environment.
The new campus is a dream come true for these students, Native kids who are a part of a high school club for those interested in careers in medicine.
A lot of us want to stay where our culture is at, and there's not very many schools around us, like in Tahlequah, obviously this is the first one, but a lot of us have to go out to search for what we want.
The goal is to enroll up to 50 students in the first class and hopefully inspire more Native Americans to pursue medicine, something many have long seen as out of reach.
A young person today can realistically say, I want to be a doctor and I want to take care of my people, but I want to do it in the Cherokee Nation. They can do that now.
Arizona hosted its first rally to prevent suicide. Community members shared stories about how mental health and suicide have impacted their lives. Cronkite News reporter Madison Atkinson explains why they're calling for suicide prevention to be a priority in the state.
Dozens of people gathered outside Arizona's state capitol to raise awareness for suicide prevention. On average, one person dies by suicide every 7 hours in Arizona, according to the American Foundation for Suicide Prevention.
To find a family in Arizona that hasn't been touched in some way by suicide,
An easy way to become more involved is to seek out a training opportunity. There are suicide prevention training opportunities being offered across the state. State agencies are offering them, churches are offering them.
Child suicide increased 32% from 2016 to 2017. 68% of those deaths occurred in children 15 to 17 years old, according to the Arizona Child Fatality Review Report. At the state capitol, lawmakers are working to pass Jake's Law. Jake's mother and father spoke during the rally to educate and support the bill.
Essentially making sure that behavioral health is being treated equally with physical health by the insurance company. It was named in honor of our son Jake, who was lost to suicide January 11th, 2016. So we just want to make sure no other family has to go through what we did.
Those at the rally want people to know mental health is just as important as physical health for children.
I think the public needs to, as the speakers were just saying, don't stigmatize this. Don't hope it will go away. It is an illness, every bit as much as a physical ailment.
In Phoenix, Madison Atkinson, Cronkite News.
If you are struggling with thoughts of suicide, you can call 1-800-273-TALK, or you can text CONNECT to 741-741.
Technology is helping rural communities in Arizona. A project created by ASU has been effective in spreading specialized knowledge to providers across the state to increase access to health care. Ashley Stewart has the story.
There's a lack of accessibility for a lot of different reasons. Sometimes it's geographical. It could be a rural community health center.
Imagine being in a remote area in Arizona and not being able to receive specialized treatment. ASU's College of Health Solutions has an innovative model called Project Echo to provide virtual access to that care.
That the community health clinician that is providing care in that community does not have the training or the knowledge needed to manage whatever the health problem is. It could be liver disease, it could be alcohol misuse, a lot of different health problems.
Matt Martin, a clinical assistant professor in the College of Health Solutions, says ECHO does not provide care. It's more about providing training and mentoring for community clinicians. Providers use video technology to receive mentoring and feedback from specialists.
It's really hard to find clinicians that want to stay in a rural area for a long time. And so ECHO can help those clinicians have the kind of support and mentorship that they need to stay in that community and to continue to treat patients from minority populations.
A 2019 study from Arizona State Health Assessment says the provider-to-population ratio in rural areas is approximately 57,000 to 1 for mental health. A statement from ECHO's director Adrian White says, in essence, we leverage technology to expand the capacity of the current healthcare workforce through the movement of knowledge into the minds that need it most. The goal is to stop moving people and start moving clinical knowledge. In Phoenix, Ashley Stewart, Cronkite News.
The facility plans to be completed by early 2021.
New tonight, a mental health treatment center is opening in Maryville, a community that has struggled to get and maintain community medical services. I talked to facility leaders about what that center means for the West Valley. Maryville Hospital shut down 3 years ago, leaving more than 100,000 people without nearby health services. Last April, emergency services opened at Valleywise Behavioral Health Center. This month, they are further narrowing a West Valley gap with a mental health treatment center.
Today, we're seeing between 80 and 100 patients a day in our emergency department. And so when you pair that with a behavioral health facility of this kind, and then with the remarkable collaboration that we've had with Maricopa County and the court, with this facility, you can begin to see how this unique facility will make a significant difference in the care of our community.
The Maryville Hospital Health Court will eventually house 192 beds, and that may mean a shorter wait time for patients.
So it really prevents the situation of someone who's in need of an evaluation but is unable to take advantage of that evaluation because there was not enough beds.
Leaders in charge of the facility showed us one wing of the behavioral unit. They say it was designed to maximize safety, without sacrificing comfort.
Our facility provides a safe environment in their room, in their bathroom, so that they're able to have the same amenities that they would at their house, but with a safer approach.
Patients can play games, watch movies, and interact with others in treatment in the unit's recreation area. The court will accept its first patients next week and will be fully operating by April.
Scientists are looking for better ways to test it.
But as Cronkite News reporter Madison Atkinson explains, help to diagnose the illness could be coming from right here in Arizona.
The Translational Genomic Research Institute in Flagstaff is working on a test for coronavirus that could be used throughout the nation and possibly the world. It's something they developed to diagnose other illnesses, but now have a new use for it.
Clearly, there's this outbreak of a novel coronavirus that is really mostly affecting China, but starting to show up in other parts of the world, including here in the U.S. And this really is a public health emergency, probably the most important infectious disease in the world right now, at least as far as where everybody's focused on.
TGen is studying what makes up viruses and can use the genetic information to diagnose illnesses.
Developed some novel genomics-based tests. So what looking at the DNA, or in this case, the RNA of the virus, and develop highly accurate tests that can tell us whether or not the virus is present and what strain is present, and potentially if there's any mutations within the virus itself.
Right now, the only coronavirus test that's available was created by the Centers for Disease Control. That test is being distributed to health labs and used on confirmed cases of coronavirus.
If the disease starts to spread, and we do see large outbreaks in the U.S. like they're seeing in China, it will be important to have a lot more than just that single test. So we want to make sure that we're ready to be able to respond and make as great as impact as possible.
TGen's test is in the approval state and cannot be used in other countries. They are currently trying to get it passed by the Food and Drug Administration for use here in the U.S.
If we get FDA approval, that would be for it to be sold and used in U.S. hospitals. But again, if we're going to work with partners in other parts of the world, we're going to have to work with their own regulatory agencies.
There is not a set date when the test will be approved. It can take up to months or years. Although the FDA has an emergency use authorization which allows a rapid pathway. Dr. Engerthaler says the best way to reduce the spread of the coronavirus is by washing your hands with soap and water and using alcohol-based hand sanitizer. In the broadcast center, Madison Atkinson, Cronkite News.
The 2011 Arizona Alzheimer's State Plan is a collaborative strategy to address the growing human and financial cost of dementia in Arizona. As Daria Yasmin reports, the goal was to bring stakeholders together to create a plan because the number of Arizonans with Alzheimer's disease is increasing.
There are around 140,000 people 65 years and older who have Alzheimer's disease in Arizona. Tempe started the first dementia-friendly city initiative in the state in 2016. Surprise is the second one as of September of this year. Outreach Program Manager Janice Greeno from Banner Sun Health Research Institute says that they see patients on a daily basis. The Family Community Services Program offers education, support groups, and a variety of classes for those with ties to dementia and those without.
If you have memory loss that impacts your daily life, and you're having to have other people help you remember things that once were just easy parts of your daily life, that's something that you should be concerned about.
Banner Health's Family and Community Services partnered with Benavia, Salvation Army, and Sun City for this initiative. Seth Dyson is the Director of Human Service and Community Vitality in Surprise. He says memory cafes are a huge part of their initiative.
To provide fun group support for folks that are experiencing dementia, and then their caregivers can go off into another room and learn about support and other resources.
To become a dementia-friendly city, Greeno says you have to come together, evaluate opportunities, and get educated about the community. According to the Centers for Disease Control and Prevention, in 2014, there were an estimated 5 million adults age 65 and older with dementia in the U.S. It is projected to hit nearly 14 million by 2060. The CDC says that age, family history, race, poor heart health, and traumatic brain injury increases one's risk of developing dementia. Greeno says this isn't just an individual's disease, it's a family's disease. In Surprise, Daria Yasmin, Cronkite News.
Physical exams, blood tests, and brain scans, like a CT or MRI, are some ways doctors can find underlying causes of dementia.
Native Americans face the highest rates of diabetes in the nation, with statistics showing that more than 15% have been diagnosed with the disease. Cronkite News reporter Jordan Elder found out how one Phoenix organization is working to change that.
Native Health wants to teach adults how to deal with diabetes, and you won't need a pencil for this class, but you do need to bring your appetite.
Has anyone used the apple slicer before? Might take a little bit of practice.
I know a lot of people in the Native American community and in the Phoenix community, they get diagnosed with diabetes, but aren't necessarily educated on it.
But this class is getting educated, and it's not your typical lecture hall.
You could always try smoothies.
Having this class, it helps them become educated, find out what diabetes is, what kind of foods they can eat with diabetes, what can help them for their overall health.
This free 20-week course is open to anyone. Smith demonstrates a healthy, simple, and cost-effective meal. And best of all, it's diabetes-friendly.
Thank you.
Today, the group made this healthy chicken Waldorf salad. And as they leave, everyone gets their own to-go bag full of ingredients so that they can make this salad at home by themselves.
Being diabetic is very expensive. And so this is a plus that they give us and very helpful that we get what we need to make our dinners tonight.
Diabetics have to be careful with what they eat in order to maintain their blood sugar levels. Usually this means eating more fruits, vegetables, and whole grains. These are much more expensive than chips, which used to be Glorine Barton's favorite snack.
It would be very helpful to a lot of people that are going through this to come here. It would really, because a lot of people don't know how to deal with their diabetes.
Living with diabetes may not be easy, but the Food for Thought program is showing people that it's possible.
Oh, it's delicious.
And it can taste good. Native Health also offers transportation to these classes to make them more accessible, and there's always a dietitian on hand to answer questions. Live in the Broadcast Center, Jordan Elder, Cronkite News.
That's it for this special edition of Cronkite News. Thanks for joining us. For top stories anytime, go to cronkitenews.azpbs.org.